Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's podcast, which is part 2 on head shaking, and we're talking about the diagnostic and treatment options, and so how you can kind of help your horse and wander on this path. How are you going today, Soph?
Hey Raquel, really good. This is going to be a good follow-up, especially for anybody who felt like they were left on a cliffhanger last episode and are looking for more information. So last time we went over why it's relevant and why head shaking needs to be seen as a whole body dysfunction. We went over the science. So everything from, how it presents being usually a vertical flicky motion, but there's other things that can present like a little bit of rotatory or horizontal, and it's worth making sure you really go through all the causes. So, you talked about dental allergies, eye disorders, you mentioned things that happen with ears and different ways that the area in the jaw can be influenced for lots of different reasons, and how, the TMJ and the nerve, the trigeminal nerve coming around the jaw, how important the hyoid function is, and just that the whole space around the upper neck, all of those things can tie into your horse's presentation of head shaking. And of course, you've got allergies, etc., things that pop up. And of course, we were just also thinking about how, with allergies, you can have, you've got irritation, but then your body's becoming inflamed. So it further contributes to the presentation sometimes. So there's lots to talk about. Getting into diagnosis though, how do you want to kick off the idea of diagnosing something so sometimes broad?
Yeah, it can be a bit of a diagnostic challenge. And I think the first part of it is getting a really clear history. Exactly when did it start occurring? How frequently is it occurring? And so keeping a diary before you even go down the diagnostic pathway, unless it's a significantly acute incident where the horse is distressed and you need a vet right now. But otherwise, if it's, a bit more intermittent, or it's not kind of ongoing and acute, then you need to keep a diary and videos, because it's really useful to then go, okay, it's only occurring under these circumstances, or it's occurring under all circumstances, like it's only occurring when ridden, or it's only occurring when it trots, or it's only in the paddock, or it's all the time, or it's only when they've got a halter on, or it's only when it's a sunny day. Like, the more information that you can have in your history, the more thorough you can be in your investigation. So that would be the number one aspect of it. And then it depends which circumstances it's actually occurring in, which will guide, the diagnostics. So there's always a process with diagnostics at which you go, yeah, we need to do this, or we don't need to do that. Like, for example, if it's not made worse with riding, then you don't need to see the horse being ridden. But if it is made worse with riding, then you want to see the horse being ridden so that you can see if there's any association. So that's going to kind of be a question. And also, if it's worse with riding, then you want to see, like, does it seem to be associated with the bit or the bridle or the saddle? Or, what if we take this away, what happens? And then what if we take this away, what happens? And what if they're in a head collar and not a bridle? Does it still happen? though, what if it's bareback versus being ridden with a saddle? Does it still happen? So it's basically in that situation a process of, well, through the whole diagnostics, it's a process of elimination.
Absolutely. You know, there's lots of things to go down, and your comments last week, you know, talking about starting with the most common things because they're most likely to pop up, and then going down the route of more directed pathways. How, you know, what are some of the diagnostic tools or things that come up that people might, you know, see along their diagnostic journey?
Yeah, so one of the things we also mentioned in part one was that thorough dental examination, preferably by a dental vet with extra qualifications in dentistry, under sedation, so they can have a really thorough assessment of the teeth, searching for any fractures, searching for anything at the back of the mouth. I mean, gosh, sometimes you can have a weird one where recently one of my clients was taking their horse to compete in endurance, and the horse started head shaking, and they looked in her mouth and she had a stick across the top of her mouth, so that was really easily resolved. Well, once
Yeah.
they were actually able to get it out without sedation, but like stuff like that, like just having a look, because there can be weird things stuck in there. So definitely a full mouth, full dental, thorough exam looking for, and I'd include a mouth x-ray in that. Thorough ear and eye basic exam, any ear discharge, any eye discharge, does the eye respond appropriately to light? Do they seem worse in light or in dark, because that can give an indication as well. So definitely those basic exams, they're not going to cost you much to do that first level of investigation after you've ruled out if it's a written or non-written aspect. Then you can go down the path of scoping, which they might do on the same day, like if you're willing to do as much as possible in the same day. So they'll scope and have a look at the soft palate, have a look at the guttural pouch, have a look at the epiglottis, so the structures in the back of the throat that are important in swallowing. Is there any kind of paralysis of that area, any discharge, any other kind of weird structures? When they also, if you do get an x-ray for the teeth, then you may as well include the jaw and the hyoid in that. It can be a bit more difficult because of the angles that they need for those, but if you can radiograph the hyoid and the TMJ when you're looking at the teeth, that's going to rule that out at the same time. So they're probably the most, and the sinuses, like you can include all of that, and you could input the pole in there as well. Like if you're going to get radiographs, you may as well, get the whole thing done. So teeth, sinuses, TMJ, hyoid, and pole would be what you'd include in those radiographs, and then your full mouth dental exam and scope. So they'd be the basic exams that you'd start with, veterinary wise.
Absolutely. And if you were going to, you know, go a level higher, where, you know, what is a possibility that, you know, things go down or there have been diagnostics done? You know,
Yeah. So sometimes then they might do a nerve block just to see how how much the nerve is irritated. Again, I don't think this is necessarily diagnostic, but it is showing you it's showing you the involvement of that nerve, but it doesn't mean that that nerve on its own is the cause. It means something made that nerve unhappy initially, but they can do a nerve block of the infraorbital nerve, which is just basically where the noseband sits, where the rope halter knots sit, and see whether that relieves it. And they could do a nerve block of the fascial and trigeminal nerves to see whether that relieves it. So it's just going to tell them, okay, the nerves irritation is what is causing the head shaking. And if it doesn't block out, then you're thinking, okay, like maybe it is a guttural pouch issue, for example, that's not blocking out, or a pole issue that's not going to block out with those nerve blocks. So that would be the next thing, because again, it's pretty cheap and easy to do. Then you would go down more diagnostics. CT and MRI would be gold standard. MRI is going to give you a bit more of a breakdown of the soft tissue structures, and that would be ideal. You're going to get a really clear exam there. Again, we're still looking at the head though. So, the cause of the symptoms is probably in the head, but as we mentioned in part one, it can be something like a hamstring scar or a pelvic issue. And so if you've kind of looked at the head and you can only go, okay, the trigeminal nerve is definitely irritated and it seems to be the cause of the head shaking, then I would look at all the connecting fascia to that area, specifically hamstrings. And that's where a full ABM, biomechanical medicine assessment, or highly qualified bodywork assessment, where they can really look at those hamstrings. Obviously, they can't make a diagnosis, but they can show you things in your horse's body. And so I'd really be looking at that pelvic function and the hamstring function. That would be the last kind of part of that diagnostics, which would come into hoof balance too.
Yeah, absolutely. I mean, feet are just so important in terms of the proprioceptive input they're putting up the limb, your limb alignment, the choices that you make about where you place your legs, and then the forces traveling up them influencing the fascia, the amount of leg fascia that there is when you see it. Yep. And yeah, it's such an important part of, the whole system, particularly for posture, which is a massive a part of the whole system, as well as the fact that, while you're going down all of these pathways and routes, it's worth considering your horse's posture even from the beginning, because regardless of issues that are popping up, any level of increased sensitivity that you have in your fascial systems throughout the entire body are going to exacerbate, will have the potential to exacerbate other symptoms that are coming up too. So it's a part of managing or understanding the whole system to be looking at your horse's posture all the time. And I think that's something we probably repeat nearly every episode, is like learning to observe posture, learning to understand its influence on your horse's body, and then learning to monitor and notice small things is one of the most powerful skills that you have, because you don't have, the everyday horse person doesn't have access to nerve blocks or sedation to do a routine dental exam outside of, your 6 to a 12 monthly, or when symptoms pop up. But posture is something that you have so much influence over. You get to observe it every day. You get to notice small things. You are in tune with your horse's body if you're riding them or doing anything with them. So you can just have so much power. There's so much in your corner if you can be aware, I suppose.
Yeah, exactly. And if you see that the horse always stands with its head up and it kind of seems stuck in that posture, that's telling you a lot of information, because that relates to that dorsal fascial line that correlates with hamstrings. So yeah, the way their head and neck position, and you can go back and listen to previous podcasts where we've talked about observing posture, especially early episodes, because it's one of the most valuable skills that you can empower yourself with.
Absolutely. Absolutely. When it comes to treatment options, there's external treatment options, there's pharmaceuticals, types of surgery, implants, the coils, and then of course you've said ABM assessment, and of course that leads to an ABM treatments or a whole body systems. Where would you start in terms of explaining to people what treatment options are?
Yeah, so obviously it's going to depend on your diagnostics, but if you've kind of ruled out everything, then it becomes a bit of a treatment experimentation. The first place I would start, which was a success with the horse that I had, was a nose mask, and there's specific ones that fit quite nicely. They're very comfortable. They go off the noseband of the bridle. And for my horse, Jack, that I was talking about in the last episode, it made a massive difference for him. Like it was what got it under control. So, and the studies say there's a 70% success in 25% of seasonally affected horses. So there's the mask, there's straps that kind of hang over the nose, which have also shown a 30 to 75% improvement rate. I think that just changes that sensitivity of the area. And then if they seem to be made worse via light, like exposure to light, then there are specific UV masks. There's one brand called Guardian, I assume it's still around, but that you can block the light and help them from that perspective. So they're the external options, obviously, apart from dealing with any tack challenges that you have. In terms of the medical options, it's a little bit of if you suspect that it's seasonal, then you'd go down the pathway of cyproheptadine, which is an antihistamine. And so it also has some local anesthetic action and some other influencing factors on calcium channels and serotonin. And often, if that's going to work, you'll see the improvement within a week. But it's a symptomatic treatment. It's not a treatment to fix the condition specifically. It's a relieving treatment, and then often what happens is you stop that and the head shaking comes back. So unless it seems like more of a seasonal issue, then you might just use it as a seasonal treatment. But yeah, you're not necessarily treating the underlying cause. You're just relieving it.
Yes.
And then other people have tried carbamazepine, and it's a human product that they use for trigeminal neuralgia. It's also an anticonvulsant and can be used with cyproheptadine. And they can respond well to low doses of that. I haven't specifically used that one. I've used the others, but that's an option. Obviously, you'd be working with your vet on all of these treatment options because these are prescription drugs.
Yeah.
Especially, well, actually, I'll go to gabapentin next. It's used for neuropathic pain in humans. It's also being used quite a lot in horses now for different things. Like I have a laminitic horse who's on gabapentin. They do say there's poor oral bioavailability in horses, so that means it's not absorbed that well through the gut. But yeah, some people, say that it's shown promise. So, gabapentin and would be your next option. If you're still struggling, then there's anticonvulsive drugs that can be used for severe cases like phenobarbital, but it can sedate them and they can be a bit weird. Like I've treated a lot of dogs, epileptic dogs, on phenobarbital, and it does change them a little bit. So, that would be more for your severe cases. You're basically kind of sedating the system to a degree. Corticosteroids, so cortisone, you can do it orally, like systemically, and pulse therapy might work. So it's like on for a few days, off for a period of time, or an inhaled version. So especially if you've got allergies that you're struggling to control, but it's inconsistent in the studies as to how successful it is. Eye drop sodium chromoglycate has been shown to help horses with seasonal and photophobic, so the light sensitivity. And basically that's kind of like an antihistamine in the eye. Again, it may come back with cessation of the treatment. And then melatonin could also be beneficial if it's seasonal as well, but it has to be dosed at 5 p.m. each day, and it can have other influences on the horse because you're kind of having an impact on the hormonal system. So you can see a lot of these treatments are focused at nerve pain, allergies, and a little bit at inflammation. very symptomatic kind of treatment base.
And of course, not all of those are going to be accessible or, as usable or user-friendly for you if you're somebody who has an aim of using your horse in competition. And that's one reason you're trying to resolve these symptoms, because not all of these are permitted in competition. They're, like you said, strong anti-inflammatories, or that they have, sedatory effects. So there's just lots of things to consider.
Yeah, the nose nets, you can get approval to wear those in competition.
Yep. So talking surgical options, what are some, things that come up with things that can't be resolved in other ways?
Yeah, so there's been a few studies on surgical options, and these are like last resort type options, really. Infraorbital neurectomy, which basically means they cut the infraorbital nerve, and so you're just stopping sensitivity to the nose area, really. And again, it's just a symptomatic treatment. So when you cut a nerve, you can end up with potential complications of, well, they can't feel that area now, and so they might self-trauma, put their nose in places they shouldn't put it. So like 84% had problems with self-trauma or nose rubbing, because the sensation is all changed. So, that's something would be a really last resort. I wouldn't be recommending it. But it depends on what you want. I'd also think you've got to consider the welfare of the horse and why you're doing it as well. Like sometimes the kindest option is, if you can't get the head shaking under control and it's creating a lot of stress, then it may be an option to put the horse down if you really can't, if it's so stressful and irritating, and you've tried. So just, considering those options. They've also implanted a platinum coil in the infraorbital nerve. And so it creates a bit of compression of the nerve. They've had 63 to 84.2% success in that was in 24 horses. So, I guess what you're seeing is a lot of these things are around that 70% success rate. You can get issues though with the coil migrating and then creating irritation. They can actually cause irritation and make them head shake. Or again, they can self-trauma with their nose too. So yeah, they're the main surgical options.
And yeah, like you said, last resort, because you'd ideally want to be having as little intervention in terms of cutting nerves and things like that as possible, particularly when there's so many possible side effects. What about what about options, in terms of diet or complementary therapies alongside veterinary style treatment?
Yeah, I always look at their diet. Like, in one of the horses that I was treating, I questioned the water supply because it was from a bore. And so we didn't really know the composition of that water. And so part of her treatment options was to take her off that water and put her on, I think we put her on tank water. So you do need to look at their diet closely, and things like water and hay. Is there mycotoxins? I have other horses that really react from a head shaking perspective with mycotoxins. So looking at those things, water and diet. Within the diet, so there's been a couple of studies showing magnesium citrate specifically is really beneficial, 10 to 12 grams orally per day. They actually monitored urine pH until they got the urine alkaline. And so, whether alkalinizing the system is a potential treatment option. So magnesium, and then they found that if they added boron to that they got an increased magnesium resorption and over a 60% reduction in signs with that. So boron and magnesium are really beneficial. And the dose rates are there's papers available on that, scientific papers. So that's easy. You can add those things to the diet. I'd also look at the gut and immune support. So reducing inflammation in the overall body. So removing any grains from the diet. Rye can be inflammatory for some horses. Mycotoxins can be inflammatory for some horses. I have one horse who head shakes. Actually, I have a couple of horses who head shake with lucid, even though that can be beneficial with other horses. Um, so, simplifying the diet as much as possible and making sure that there's not a dietary influence, and getting a herbal support program, from an immune and gut support. Recognizing that from this perspective, it takes time, for the gut to heal. You're looking at least 3 months minimum. And often head shaking in itself, the treatment is lengthy. I get the odd one if it's an acute flare up, you can get the odd one where like we treat it and a couple of treatments and it's gone. But the longer that it's been there for, then the more complicated it is to treat. And the longer it takes to treat. Like I'd be allowing a good 6 to 12 months.
Root cause treatments aren't often an overnight thing, especially if you have something that's been compounding for a long time or has now come to a head or has got to the point where the symptoms are noticeable. Then you're working backwards with something that was already there for a good while.
Yeah. And if the horse is really irritated, then you're looking for that symptomatic treatment that's going to give them relief, and that's where the medications can become beneficial. But then looking how you can address the entire system. Haven't had any experience myself with homeopathy, like with head shaking, but that's a potential treatment option. And 100% recommend craniosacral therapy. So when I did craniosacral therapy study a fair few years ago, I asked the instructor like what was her success with head shaking, and she said she'd had 100% success at that point. So definitely find yourself a well-qualified craniosacral therapist, and stick to that for a good minimum of 3 sessions. And yeah, that needs to be a part of a holistic treatment approach. So it's not, yeah, and acupuncture can be in there as well, like chiropractic and acupuncture. I mean, my horse did have acupuncture and he improved very slightly, but there's variable to limited kind of studies on that, and definitely would try it, especially if you can get an acupuncturist who comes from a traditional Chinese medicine perspective. So they're looking at the entire system and not just doing acupuncture for head shaking, because I do believe it's a whole system problem, not just a head problem. And then there's been some studies on percutaneous neural stimulation, and there's some really good success with that. So they've done a lot of studies in humans with trigeminal neuralgia. What this does is pulse an electrical current. So they actually put it under the skin, over the nerves. The horse is lightly sedated and it pulses this electrical current. It's well tolerated, and they do it for about 20 to 25 minutes at alternating frequencies. And they repeat it 3 times about 3 to 14 days apart. And they found they did a minimum of 3 and up to 6 sessions. And at that point they went out to every 2 weeks. They got improved results with subsequent treatment. So they'd see some improvement, but then as they continued the sessions, they were seeing more and more improvement. So with 3 treatments, they got 53% remission in 136 horses. The remission, though, wasn't permanent, with about 15% only remaining in remission at 156 weeks. So this just shows, I think, looking at it from a whole body perspective. This is one part of a treatment option that can be very beneficial. And the way that you can do it that's non-invasive is TENS, which is transcutaneous electrical, oh, I've had a block. Anyway, TENS, and what you can do is you put the electrodes on the face. So I did this with a horse that I had that was head shaking, and we'd tried everything and we'd got improvement. And the owner was doing a full postural rehab program. This was the one that started during exercise with the hamstring issues. I clipped the area, I put on the TENS, sedated her, and we just did it at the highest frequency that she'd tolerate for about 20-25 minutes. We did it at least 3 to 4 times, and it was a turning point for that horse. So, you know, the last time I spoke to the owner, like, she was back riding the horse and she was going really well. So, but like I said, it was part of a whole, like, I was doing body work on her, I was doing craniosacral, we were doing postural rehab, we were looking at the diet, we had her on magnesium and boron, we looked at the water, we'd had her teeth fully examined, like, it was a, you know, a full body kind of session. But that's an easy one that you can apply with a practitioner who understands the use of TENS. It's quite cheap, actually. It's not overly expensive. And then with a whole body kind of postural aspect from there.
To support and make sure that you're rounding out the whole system.
Yeah. Yeah. It's no different
And
to people with allergies, you know? Like, you can take antihistamines every day, but ideally it would be good to figure out what's creating the inflammation in your system, so that, you know, like, I used to have such bad hay fever and such bad allergies, but the more I've reduced foods that create inflammation in my system, like amines create inflammation for me. So I know now if I have some dairy, I'm more likely to get nasal congestion and sinus issues. And I also know if I have a lot of amines that I'll also end up congested, or my hay fever will be flared up. Or if I have too much coffee, my hay fever will be flared up. Like, anything that creates inflammation in my system will flare up my allergies. But I can now go, like, just get hay fever once or twice a year, whereas I would have it, like, you know, that horrible hay fever where your whole head feels like you just want it to be cut off. So that was a whole system kind of, you know, treatment.
Yeah.
Instead of just going, okay, I'm going to have to take cortisone and antihistamines for the rest of my life every season.
Yeah. And just seeing how, you know, it's so interesting. Often one space or one part of your body becomes kind of a beacon for being noticed, but there's so many underlying things, you know, like a process, and often it's chronological. Like, over time, it's, you know, it's either built up or there's a threshold or there's things, because your body has such a capacity to heal or to manage or to, you know, have its own system of allostasis. You know, it's like it's constantly balancing around something. So, you know, diet for me flames up, you know, certain areas of pain. And when I've managed myself well, you don't feel it, but it's, you know, even though I'm feeling it in one area, my entire body has been influenced. You know, I'm just feeling an inflammation in my lower back or in my bowels or a place like that, but it's your whole system. So if you're able to support the body all over, and, you know, I swear every second episode we also have an example where something, either our tummy or our feet or, you know, headaches, the ability to feel like you're hydrated is influenced by how you've been moving or what you've been eating. So the ability to support the horse's body constructively from lots of different directions is going to give you support. And I know you've always said it's wonderful to change one thing at a time, but doing as much as you can, because it's often multifactorial, is very constructive too when you're aiming for a good result.
Yeah, like, it can be difficult because I understand the value of changing one thing at a time. You want to try to rule that in or rule that out. But if you've got a system that is in a state of inflammation, then I'll often throw everything at it and then reduce it to figure out what I need to keep them on, So and it depends from a veterinary perspective. Obviously, the drugs, we often want to you might try cyproheptadine, that didn't work, add in gabapentin. You don't want to get in the thing of all of a sudden having 5 drugs. So with the drug aspect, I would try this, maybe stop that, try this, stop that, try that, like the cortisone, etc. But from a holistic perspective, like I would, if the diet doesn't look right, I'd change everything about the diet. And then over time you'll figure out what creates a flare up. Like I said with my client, she knows lucin creates a flare up and she knows mycotoxins create a flare up. And so she knows now what to do when her flare ups happen. So it's figuring that out. It's like when I figured out with Jelly that he had a muscle condition, I was like, okay, what do I need to do for the muscle condition? I need to add this, 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 and cut out this. So I did all of that. And then over time, I've gone, okay, these are the 3 things that I have to do. Like every time I stop these, his muscles are worse. So, but when you're trying to get the whole system in balance, if you just say, oh, well, I'll just cut out lucin, but you've still got all this inflammation in the system, like because they're still on just other inflammatory foods. Maybe it is the lucin that's causing it, but you've still got inflammation in the system. So you've got to kind of support the system as well as figure out the cause. So, it can be a bit complex, but that's like I said, with the horses that I've treated, they've had body work. I've been looking at their whole body. The owners have done postural work. We've done TENS on a couple of them. We've also supported their gut health from a herbal perspective. We've looked at their diet and just seen, can we kind of change anything in their diet? So it's been a holistic approach to their care. And like I said, done some craniosacral in there. I've used taping with them as well to try to help reduce pain and inflammation. And that was really beneficial on a few cases, actually taping through that area. So I just want to get that horse comfortable initially, and then we can kind of revisit as required.
Definitely. And yeah, keeping a diary and taking videos
100%.
are such a wonderful tool, such a privilege to have, photos and cameras and things, because it's easy to
Forget.
And also if you are dealing with something over multiple seasons, it's something that remembering a symptom over multiple years, it's useful to have data to look
Yeah, and
back
I
at.
would go back and I would say to people, oh, like, how's the head shaking going? They'd say it's still there. And that would be their focus. Was it still there? And I'm like, yeah, but how often is it still there? Is it still there under all of these circumstances? Is it still as bad as it was? Are they still doing the leg rubbing or the nose rubbing that they were doing? And they'd forget those things. Like they just notice the head shaking is still there.
Yeah.
So yeah, the benefit of having that diary is that and obviously I can come in at whatever as an outsider and it helps because I can remember what they were like last time. But then I can say, like, they can go back to their diary and go, oh yeah, she was leg rubbing like all the time and now she's just doing it twice a day. Or like she was nose pressing this much and now she's only doing it at this certain time of the day. Or, so you don't always notice when symptoms have reduced. You'll notice when they flare up because they're annoying. And even for us, like, we won't notice that we're like heaps better. We'll just notice what's still there. So I've had that happen heaps of times with clients where they come in and they'll say something like, I'll say, oh, how's it going? Oh, yeah, it's not any better. And then I question, what about this? What about, oh, yeah. Like the dog did jump on the couch the other day. Oh, he hasn't done that for 6 months. I didn't even notice.
Yeah.
The horse did go for a canter and not shake its head. Oh, yeah, I forgot that it head shook every time it did that. So, yeah, really important to have that diary.
Definitely.
Awesome. Well, any other takeaways?
No, I think that's quite a lot to think about and to process and put into action by going out and observing and thinking about whether or not, if it's relevant for your horse, what you've done and what you can do.
Yeah, pick up on those early signs. Be willing to explore those veterinary diagnostic options, and then also work with someone who can help you develop a holistic plan. I do offer online consultations, so I've done a couple for head shaking horses, and it's also just handy to have somebody who can look at the whole picture and help you to make decisions, and see that you've exhausted your options. So awesome. Well, thank you for joining us for the head shaking part 1 and part 2 of the episodes. Thanks for joining myself, Dr. Raquel Butler and Sophie Vanderberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights.
And we'll see you in the next exciting episode.